Welcome to the Doctor Connect Show, the home for open conversations where top experts share their experiences and empower you with transformative education around cancer, health, wellness, and medical technology. I'm your host, Dr. Ludmila Schaefer, medical oncologist. And if you are looking for a better health, global partnership, and want to make a social impact, you've come to the right place. From sacrifice to a celebration, and the answers on how to turn your life around. I'm super pleased to announce that my podcast launched in February. I'm so excited to bring my years of experience as a medical oncologist to the podcast and television world. Listen, watch, give a rating, and subscribe so you never miss an episode. And if you like our show, subscribe and comment what you like about the show. And go to the website, thedoctorconnect.org, and click the button, Submit the Question. You can either submit your question, or if you want to share your medical journey or health wellness story, simply type, I want to share, and we will reach out to you. And if you are in healthcare and you would like to spread your expertise globally, schedule a consultation call, National Impact Strategy. Whether you're a clinician, researcher, entrepreneur, mentor in leadership coaching program, we discuss how to spread awareness of your expertise. I am so thrilled that today our very special guest, Dr. Fatemi. Dr. Lida Fatemi is a board certified hospitalist, so please stay till the end of the show because you will learn a lot of valuable information. Dr. Lida Fatemi, who is an award-winning academic physician, board-certified hospitalist, educator, mentor, and a life coach. She is the author of the book, The Gag Order, The Story of My Becoming. Immigrating from Iran to the United States when she was 14 years old, she can relate firsthand to health disparities by bringing awareness and high-quality psychiatric care for children. Receiving a degree from Emory University, her research focuses on studying Native population, medical economic, quality improvement, and underrepresented population. She contributed for over 20 years to research, passionate patient care, and economically sustainable treatment. Under her leadership, her health system thrived financially. In addition, she uses life practices to help physicians find meaning and purpose to their lives and work through conscious life practices. And Dr. Fatemi will tell us what it is. Let's welcome Dr. Fatemi. Dr. Fatemi, welcome.
Thank you so much for having me.
Absolutely. I could not think of a better guest with credentials than you are, because the April is the month of stress awareness, and you are the best person to speak about it. Can you please tell us a little bit about yourself?
In my 10 years of experience as a physician, I've never seen this much adult mental suffering. According to the National Institute on Drug Abuse, death by overdose doubled from 2015 to 2020. Additionally, child torture cases increased 12 times because of isolation. As a board-certified hospitalist, I see it as my duty to bring awareness and educate the community on conscious life practices. What I do with this is I help you heal through self-reflection, through trauma engagement, and togetherness and relationships, to create tools that you can live a better life with, that you deserve.
Thank you so much. Your work is so important, and I can't wait to dive in our conversation. Can you tell us definition of stress in your words?
It's when we are in a fight or flight mode.
So when we in fight and flight mode, any factors play a role, maybe genetic or lifestyle, I've heard that, well, not only heard, of course, we know that the stress causes a lot of life threatening medical conditions, and it also depends on our social environment. So, where are you standing in terms of that issue?
It's multifactorial. I think a lot of it has to do with us being so distracted with our outward environment, with news, with, what's going wrong all the time, instead of looking at what is going right. What is, 99% of what's happening is fine right now. And it's where our attention is, and how we deal with it. So, yes, lifestyle has a lot to do with how we can manage our stress. Stress exists no matter where you live, no matter what you do. How do we manage it? How do we cope with our stress is what really is important.
Absolutely. In fact, I agree what you just said. We are here, some of us sitting, and yes, we are fine. And yet we think that we are stressful. But what right now going on in Ukraine, and there are so many psychological consequences. I recently was involved in saving person from Ukraine, and it's really looking at the situation there, especially children, and the consequences of exposure of war and the terrorism during childhood. What can we do to prevent this from your standpoint?
Thank you for bringing this huge issue up. It is so sad to watch this happen. And I have a direct experience with that. And I know what those children are going through. Not exactly, but, similarly, I grew up in war for the first 8 years of my life.
So
And
sorry.
it was not easy. It was very difficult. My parents had to do a lot so that we didn't feel the scarcity of war.
Mhm.
But here I am, 30 years later as an award-winning physician. So there are absolutely ways that we can implement into our lives. It takes some practice, it takes some changing of the old conditionings that we've had, but we can do it.
So, what one of the things we can implement today, right now?
Yeah, the first thing is to come together. Togetherness is healing. Get off the couch, go outside, go for a walk in your neighborhood. When you come across a neighbor, just wave, smile at them, say hi, ask about their family, show interest, be curious about them. Allow them to ask you questions and share about yourself honestly and authentically. That interaction right there is so therapeutic because you know that you're not alone. Your neighbor knows, oh, I know so and they're so nice. So when they feel like they're lonely and helpless and there's no one around, all they got to do is look around and they know the house across. And that is so nice. It's so healing. The other thing that I actually do myself is when I'm cooking, and I usually make a big meal for my family. I take a small piece of it, put in a small Tupperware, and I text one of my neighbors and I say, "Hey, I'm coming over. I'm just gonna drop this off. I'm not gonna intrude on your activities, but I'm just here to share with you." And you don't know how much people just love that. And it brings us together. It shows all of us that we care about each other and there's love in this world and there isn't just badness and the news.
I think this is such an important point because this is something that we all can do today. In fact, the whole audience right now, I advise, just like Dr. Fatemi said, get up from your chair, from your couch, and share the meal. In fact, Dr. Fatemi, I'm glad you brought this up because when I grew up, we could just knock in the neighbor's door in a house and share loaf of bread or maybe, piece of little bit piece of sausage. Little things make happy. So thank you. I love togetherness. Absolutely. It's interesting what you just said, and sometimes we go to people's home and it can be a very vulnerable moment. And I was just now thinking of vulnerability. I remember in the past, we used to consider vulnerability as a part of weakness. And in fact, I also experienced and seen several years ago when some people in administration, they actually taken advantage of people's personality being vulnerable, even advance themselves in the career. So, and then if we take Dr. Brene Brown, actually she turned it around and describe a power of vulnerability. So I would like to quote her. Dr. Brene Brown said, "We associate vulnerability with emotions we want to avoid, such as fear, shame, and uncertainty. Yet, we too often lose sight of the fact that vulnerability is also the birthplace of joy, belonging, creativity, authenticity, and love." Dr. Fatemi, what is your intake on this?
That's so beautiful. And you put that so beautifully, Dr. Schaefer, where, I firsthand experienced what you were talking about, the first point, that when you are vulnerable, especially as a female in the medical community, as you're going through medical school and residency, and many women in careers who have had careers share this sentiment where, oh, if you have a child, if you are vulnerable, if you gotta go home sick, like, it is not okay. Yes, I agree with Dr. Brené Brown. On the other side, when you are vulnerable, you open yourself up and you allow others to come in and you allow that connection to deepen. And you will be so surprised to find out the answers that you will find to your life when you do open up. And when we come from an open place, it's oftentimes goes in a beautiful direction, because I know we're afraid of the answer a lot of times. Like, what is the other person going to think of me? Are they going to think less of me? No, vulnerability is courageous. It's showing them that you are in touch with yourself, you're in touch with your feelings, and you want to learn about yourself. And that's it, share.
Absolutely. In fact, we a lot of times we think that what's the other person will think, and it's always worst. So a lot of
Yes.
times, why don't we think that this person actually going to think better? What do you think? Where is this cornerstone comes? Why we humans we feel that the other person will think worst of us rather than better?
I think a lot of it has to do with our conditionings of the past. And this is why parenting to me is the most important job in the world. Because whatever I implement or however I communicate, my kids pick that up. And if I'm coming from a dysfunctional place and I'm like, oh, I have to like have all my guards up and I cannot be vulnerable, then my children are going to pick that up too. And it's going to go generation after generation. They're going to project the same thing to their children. And I honestly think a lot of it comes from that. A lot of cultures, see it as that. But I think we're in a time in humanity where we have lost so many people in this past 2 years,
Mhm.
and people are feeling more open and humble, and they want to hear that, hey, if you're going through a hard time, I relate to you, and I know it sucks, and I feel you, and I want to hold your hand. And when we all go through this globally, then put the fear away, be there for each other. And if someone calls you and is vulnerable with you, just listen and be with them and connect with them and open yourself up. Maybe you can share a vulnerable moment about yourself with them, and your relationship will transform, not only with the other person, but your own relationship with yourself also transforms, which is beautiful. I've seen so much happen with just that exercise.
And I also have heard that sometimes people go, and the same works for me, go maybe to the, forests or see plants. Different people maybe find a different way of, check with themselves and find themselves more comfortable in a certain environment. Maybe someone likes next to the water, someone likes, I don't know, maybe shopping. That's not about me, but there's some environment. Can you comment what maybe certain environment could play a role also where we feel more comfortable and do our self-reflection?
Absolutely. Nature, Dr. Schaefer, thank you for mentioning that because nature is number one. The energy that comes from nature is the most pure, authentic energy because the tree is not pretending to be anything that it isn't. It's just a tree. And whether you like the branches, you don't like the leaves, whatever it is, it does not care. It's just a tree. And so that energy that it flows through the tree, through the grass, through the beautiful flowers that we see in nature, the energy there is very authentic and you can draw from it. One exercise that I do with my clients is when you go on a hike, when you go on a trail close by at home, even if you are in your neighborhood and you just want to hang out with a tree, do it. Or you want to hang out with some roses, take your time, be there with them. And as you take a deep breath in, you bring that nature energy in and you breathe it out. And you breathe out what does not feel good to you, what does not serve you in your body, in your being, and you give it away to nature. It washes out the energies that are blocked in us and we feel uncomfortable. And, nowadays, a lot of people are meditating, which is wonderful. And just to seeing how that makes you feel, just that, hey, how does nature make me feel? This exercise Dr. Fatemi gave me, how does that make me feel? Go do it. Without doing, you will never know. You got to go outside and do it. Exchange that energy, feel it, and you will see that your life will change little by little. It doesn't have to be overnight. It's little by little that things change, and stay consistent with it. If you don't stay consistent, we don't see results. Stay consistent and practice it.
Absolutely. Actually, I agree with you because nowadays, we think a lot of times, oh, we need to see the doctor and get prescription. And a lot of times we get stress. Is it acute stress or chronic stress? And of course, sometimes it needs to be controlled with medication, but it's just medication. But we are losing such touch. And probably right now in the healthcare system, maybe also could be brought in additional services to provide this, because when someone feels stressful, in addition to any chronic condition, medication and implementing those tools that you suggested, maybe even additional part of research that we need to focus right now.
100%, Dr. Schaefer. Thank you for bringing that in. I have a perfect example. In the hospital, I take care of very sick patients, and all the patients, almost all of them, have medication after medication, maybe 10 to 15 medications that they're on. And every medication has its toxicities too. So some of these medications, I would say about 20% of them are absolutely necessary for the patient. They have some kind of heart condition, they have some kind of, infection, and we have to treat with medication, and that has its place. But a lot of what I see is stress related, as you started this conversation. It is that people are in the state of chronic stress. And what chronic stress does is it increases your cortisol levels, and you never give yourself a break. You never go outside to take a break in nature. And so your cortisol stays high, stays high, stays high. Then our immune system stops working properly because our homeostasis, the way our body works, the way our cells work, is pulsatile. So you have a hormone that rises up and it goes down, another hormone that comes up and then it goes down. It's not this constant rise and staying of the same hormone, which can be very detrimental to our health. We know that people who are chronically very stressed and have high cortisol levels, they get heart attacks, they get heart disease, their mortality is higher by a very significant number.
Yes, and also in addition, that when we have fatigue and people sort of feel tired, we have to remember there are also some medications, especially in my field, someone gets immunotherapy, it can also compromise and cortisol level can be low. So any of those hormone disbalance that we do not have this homeostasis. Thank you very much, Dr. Fatemi. Now I would like to switch conversation from environment to our homes. Obviously, we have been staying at home for a long period of time, and so many things accumulated. And even I'm a minimalist by nature, but even I somehow accumulated. There is, light needs to be done, and I had to get microphone. And in addition, a lot of people sort of accumulate things. And I also discovered that actually hoarding is a diagnosis that was stated in 2013 as a separately disorder. And experts first classified as a form of obsessive compulsive disorder, but now it actually recognized as a separate conditions. So researchers found that this also could be additional form that we can, work on, and our stress level decrease. Can you tell us, is anything we can do at home right now to improve our health and decrease our stress?
Yes. Get off the couch, go to your kitchen, pick out a drawer, whichever it is. Pick it out, open it up, look in there. What do you see that does not belong, or doesn't look pretty, right? Like, it has to be pleasing to your eyes, no one else's but yours. Look through, get rid of what doesn't belong. A lot of times there's just trash in there. Just take it out, take it out, take it out, clean it out, take all of it out. Vacuum the inside, get a paper towel, wet it a little bit, clean it. And all you got to do is one drawer. It takes 15 minutes. And then put it back in. Put the things that belong back in neatly and beautifully. Just that exercise declutters your mind, takes away the stress, makes you feel good inside, it makes you feel more confident. It has so many benefits. And if you see that it feels good, keep going. The next day, not in one day, give yourself time. And the next day, go through another drawer. The next day, go through a drawer in your closet. And what you don't use, someone else will use and will be so thankful for it. And you will feel so much better about yourself. And all the thoughts that are just running in our brains is a representation of what's happening in our environment too, because our mind likes to be, attached to different things in the environment. And so you decrease that. And so I love that you're a minimalist. I'm similar.
Excellent. So I advise all audience right now, and not only you going to bring a meal to your neighbor, but you're also going to clean the drawer in your kitchen. Thank you.
Yes.
Absolutely. And Dr. Fatemi, I went to your website, and you teach about so many things. You provide such a valuable information. And one of the things I came across that you talk about engagement and stress. Can you tell us what is it engagement has to do with the stress?
Yes. So oftentimes, when we feel something is challenging to us, when an obstacle comes up, we run the other direction by ignoring it, by feeling lazy about it, by being like, "Oh, I'll do it tomorrow. Oh, I'll talk to her tomorrow. I'll do it later. I'll do it later." Well, I invite you, instead of putting it off, to engage with that challenge. Let's say you had a difficult conversation with your sister about something that happened. Instead of saying, "No, I'll deal with it next week." Well, by next week, I don't know what's happened. So much changes. And instead of doing that, hey, well, how about I pick up the phone and I just text her? I'm like, "Hey, I love you. I care about you. I want to hear your voice. Is everything okay?" Pick up the phone. Even if no one picks up the phone, it's okay. You've reached out and you are engaging with what that challenge is bringing you, and you're learning something about yourself. And the other person is learning something about you too, that you care about them.
Yes, it resonates with me very much. Actually, I absolutely support. But I also know some people who maybe like different. They go to the cave and they do not like to engage. So, what's your intake on the other side of the coin?
Yeah, I say if you are that person, that's okay. Accept yourself for what you are. And that is beautiful too. And some people take a longer time to deal with something that comes up, and that is okay too. And know yourself. And that's where self-reflection comes in, is that path of self-discovery. Get to know who you are.
And today we discussed so many things, and I absolutely love having conversation with you. And we learn about togetherness and vulnerability and decluttering and the trauma engagement. So many valuable information. How can audience connect with you?
Sure. So if you go on consciousphysician.org, you can find me there. I also have social media on Facebook and Instagram under my name, Lida Fatemi. I'm more than happy to connect with you. In fact, it's a privilege to connect with you and be a part of your journey.
Thank you very much, Dr. Fatemi, for being on the Doctor Connect show. We love you over here. And thank you for providing such a reasonable, valuable, and extremely important advice, especially during April. And I wish you the best success. Thank you very much for everything you do, saving community, providing this education. This is a huge impact. Thank you.
It's my privilege. Thank you so much for creating this platform, Dr. Schaefer.
Thank you for being with us on the Doctor Connect show. Do you have a question, an idea for a topic, or would you like to share your experience or expertise? Go to the website, thedoctorconnect.org. And don't forget to follow up on the social media and join and subscribe to my YouTube channel, The Doctor Connect. We are super excited to have you on this journey with us. Thank you for watching and listening, and we are looking forward to seeing you in the next one.